Hello, future YouTube viewers. We're doing a video here today by Dr. Zubin Damania. I believe it's pronounced Z-Dog MD. And see what he has to say here.
Hey everyone, it's Dr. Zubin Damania. That's right, when I use my full name, it usually means stuff's about to get real. Okay, guys, I've heard about the firing of Dr. Ming Lin up in Washington State. He's a physician and emergency doctor who was fired by his organization, Peace Health up there, for speaking out about the complete lack of PPE and protection for frontline staff. Now, this has been reported all over the place, and here's the bottom line, guys. As clinicians,
Yeah, this was some pretty bullshit situation. Guy gets fired for uh, basically speaking out that um, his people weren't getting the protection they needed. And that's not cool.
as the tribe of healthcare, COVID 19 will be the catalyst that burns this broken system to the ground. And here's why.
We can only hope.
When you have a dominator hierarchy where the profession is run by MBAs at the top getting ridiculous salaries who have never touched a patient, right? And I'm not talking about clinician leaders. I'm not talking about.
Uh, that's an interesting question, Jarson Wire. I do believe in social justice, yes. Uh, I do believe that our world would be better if things were more equal, yes.
All those
If that makes me an SJW, then yes. You mean a socialist? Yes.
organizations around the country that are so well led, where it's a team, where every member of the team has a voice, where we're all in this together, where everyone's practicing at the top of their training.
No, I hate the USSR. It was a terrible authoritarian regime that was not in any respect socialist after the 30s or 40s, depending.
Together in service of the
No, I am a socialist. But socialist does not mean that I automatically support the Soviet Union.
patient and each other. That's called health.
No, you're wrong. Uh, how socialist the Beatles were is something of a question. I don't have the information to get into. They definitely uh, had some love for the USSR, but that doesn't affect what I believe or want to happen. The USSR was not an example of socialism, nor communism, because communism has never existed.
Health 3.0. That's not what we have in most institutions in this country. What we have is the scenario where
No, China has whatever brief socialism existed in China ended with the death of Mao Zedong. Uh, and Cuba has been getting uh, more socialist as they've introduced more worker control in the economy, but they're still mostly authoritarian. China is the source of COVID 19. Yes, this is true.
a business person turns a beautiful sacred calling, our sacred calling, into dollars and cents and yachts and bonuses and golden parachutes. And then
That is not quite accurate. It was I've actually seen some arguments that capitalism causing us to constantly expand and grow is what caused us to break into this ecosystem that created and released the COVID virus.
when a crisis happens where we're called on to sacrifice our lives in service of this calling, they sit there and say, you can't have a voice. Okay,
So he has some very interesting information about the medical field here, but it's worth noting that this is not unique to the medical field. just about every field has been taken over by accountants and business majors, people like that who will try to squeeze every dime they can get out of a business, out of a service, until there's nothing left.
This ends today. This is the end.
And I really hope his fire spreads to other people in the medical field so that they can uh, affect the change they want to make.
Of the administrative technocracy that has destroyed medicine. COVID-19 will wash this filth back into the sea from which it oozed out. This is the end of it, and I'll tell you why. We on the front lines of healthcare will hold every single leader accountable when this is over. And why do I say when this is over? Because now we're doing what we do.
Sorry to hear that, B.B. Brazy. He's a buffoon who literally only exists to enrich himself.
To save lives with no support, no protection. And when we speak out, what happens? You're fired. Is this the most absurd thing you've...
Ha 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 ha. Yeah. Trump said Corona was a hoax and it'd be over in 2 weeks. Because Trump is an idiot.
Ever heard in your life? Here's what we demand as clinicians, because when this is over, we will never forget what they did. When this is over...
I hope that's true. I hope that when this is over, people remember what was shown to be necessary, what was shown to be essential, and what wasn't.
This is what we're going to demand. And if they don't give it to us, we are going to walk. We will create it ourselves. We will go to those organizations that are already doing this, and they...
To be perfectly honest, I've thought about this. If it weren't for the fact that it would mean millions of people would die, I think we would be looking at doctors and nurses walking out right now. But I do not blame anyone for continuing to go to work, especially in the medical field, given that not doing so will mean many, many orders of magnitude more people will die.
Exist all around the country, clinician-led, wonderful groups that take the MBAs and use what they know to keep the lights on, while people who actually are at the bedside touching patients run the show. What we demand is this. We demand an end to gag orders. We demand an end to non-competes. We demand an end to non-clinical leadership telling us how to take care of patients. We demand an end to the administrative technocracy. We demand an end to HIPAA as it sits. It has been a gag on us. We're unable to innovate. We're unable to speak out. HIPAA should be a choice for the patient. They control their privacy, not you.
I agree with that. If HIPAA is causing issues with people being able to get with information being able to spread so we can help more people, then it's not a good thing. I understand that it's often used to protect people from issues they don't want getting out, but if it's causing more harm, like this medical professional was saying, I'm all for it.
How many times have we heard HIPAA being used as a sword against clinicians who need to speak out? Well, we're worried about patient privacy. No, you're not. You're worried about someone figuring out how much you make and how little you do to actually help patient care. You are a parasite. And when this is done, the people who have done this, the people who fired Ming, anybody like that, we're going to flip the script. This is that call to action. We will demand that they be fired. Instead of firing us, they will be gone. All right? We demand that EHRs are no longer a cash register, that they help us take care of patients. We demand an end to nurse slavery. Nurses are not slaves. They are not commodities. They are not cost centers. They are the beating heart of medicine.
I can tell that this guy is a practicing physician who is wanting what is best for the medical field with that impassioned speech right there. I have my sister, I already said, is is in the medical field. I have a cousin, actually two cousins, who are also in the medical field. And nurses are what do, according to them, like 90% of the work in a hospital. So, uh, yeah, the nurses need much more recognition than they get.
They are part of our team, and they will be treated as such, or you will go. You will be gone. Not the nurse, not the nurse who speaks out. You will be gone. We demand teamwork, where every person in the team has a voice, is practicing at the top of their training.
Seize the means of production, comrade. Take back the hospital. No cap.
And collaborating with each other to support not just our patients, but each other. Right? We'd like malpractice reform. We're tired of covering our asses, racking up costs for no benefit to the patient.
Insurance is a scam in just about every field. You're basically paying X amount of money into a fund, hoping you'll never have to use it.
We would like,
and it's often only an issue because our economic system keeps people on the brink of bankruptcy. So if they have an issue, they can't afford to fix it themselves. So they pay money each month into an insurance so that when it happens, they can pay it out over a longer time.
Okay, in return, to do some things. We would like to actually have quality science be a thing, quality improvement be a thing. And we promise that we will step up and realize and admit and fix the fact that most of what we do doesn't help patients. We do it because we're paid to do it. That has to change. Our incentives need to change. We need to be paid to do telehealth. Hello, most of what we do doesn't need a patient to come and sit in a waiting room and pay a copay and be miserable. And we have to promise to focus on preventing patients from ever needing to come to see us. Wouldn't that be something?
It's worth noting that most of what he's calling for here would be helped with Medicare for All, especially the preventing patients from having to come to see us. If patients have access to free and cheap, free at point of service medical care, then they'll come in with the slightest thing rather than waiting until it's too easy.
Instead of sick care, going to actual health care. We call that Health 3.0, and that is coming after this COVID crisis. The COVID will be the catalyst that burns the old system down, and the new will emerge, and it's going to be so much more connected, rehumanized. Technology will enable our human relationship instead of obstructing it as it does now, and we will hold ourselves accountable to step up and make sure we wash our damn hands, because we still don't, and we're costing lives. We're going to look at the things we do with a critical scientific eye and go, does it actually help, or is it just getting me paid to do this procedure? And we'll realize that we have to hold our patients accountable, because right now they expect a magic pill for everything. Those people that are sitting on the beach, going to the bars, not socially distancing, okay, we still take care of them when they show up and get ventilated with ARDS in the unit, because that's what we do. But it's time for them to uphold their part of this social covenant. We are all in this together, right? So here's the call to action. It's time for them to uphold their part of this social covenant. We are all in this together, right? So here's the call to action.
It's always funny to me when people talk about Medicare for All making slaves of doctors because they'll be forced to work for whatever. And that ignores the fact that doctors and nurses are already slaves, in that you can't really refuse to treat someone. There are certain circumstances where you can. And more than that, it would go against being a doctor to refuse to treat someone. But they call them a slave because they'll be forced to work for an undetermined amount of money, which is ridiculous. No proposal is calling for paying practicing doctors necessarily significantly less money. There may be some pay cuts for like administration doctors. Like actually, I was reading an article that talked about medical staffing and how a number of practicing physicians are also administrators in the hospital. So those kind of jobs may receive a pay cut under Medicare for all, but doctors will still get paid. Like the whole point is to eliminate the insurance companies that siphon profits from the people who go to the hospitals just because that's what companies do. Making medical care a for-profit industry is basically the number one thing that has broken it.
Any administration that is misbehaving during this time, you, the frontline clinicians, hold them accountable. If we all speak out at once, they cannot fire us all. You know why? They desperately need us. They desperately need us. And they have taken advantage of our altruism and our work.
All bosses need the workers more than the workers need the bosses. This is true in the medical field, in construction, in service industries like restaurants and call centers, customer service. The workers do not need the boss needs the workers. And I really, really hope that that gets driven in with this coronavirus pandemic.
Work ethic for way too long. To the leaders that are doing such a wonderful job, and I get messages from them all the time about how they're working 24/7 to try to get PPE when they can't, to try to support their clinicians, to open up new spaces to take care of COVID patients. We love and support and will work with you. All right? Share this video. The COVID Manifesto begins today. And when this is done, we will never forget, we will not stop this momentum, and we will fight for our patients and for our colleagues to the very end. Understand.
Yes, I love this guy. But yeah, that was an interesting video, a very good manifesto and call to action. This is a really good call to action, I think. A part of me is kind of like, I wish he had been more strident about how this is the cause, that the root cause of this is capitalism, because he kind of makes it seem like it's the fault of the administrators and people like that who caused this, rather than the system that created a place where they could come to where people would, by the nature of the system, put profits over people.